Yeah, I'm sharing my screen.
Okay.
So this is the official website of the software. So over here, once you have entered into apps.isavin.com, you will be able to view this page where you have to enter the customer ID. The customer ID is unique for a hospital. So once you enter the customer ID, you will be able to view your hospital name and then the banner. This can be added in the your hospital gate settings. So now I'll be entering a mobile number, the mobile number of the user, and the password. If you have a separate, if you have a two, three branches, then all the branches can be managed from the same credential. So since this is a admin account, you will be able to view all the modules over here. Yeah, and if it is a doctor, if it is just a doctor, then the doctor will be only able to view the doctor's dashboard and the related modules that needs to be assigned for the specific doctor. So now I will be showing you how a doctor's dashboard looks. So this is the doctor's dashboard, where over here in this dashboard you'll be able to view the overall appointment overview. How many appointments has been scheduled for that specific doctor can be viewed here, and then the task that has been scheduled for the doctor, the admitted patient, the patient that is left to be reviewed, the OT patients, all can be viewed from within this dashboard. So to view the patients that are under the OP will be moved to this OP list. So in this OP list, you will be able to view all the patients, all the appointed patients of that particular doctor. So since this doctor is having one patient, that patient name, the details are added over here. So now to move to the now if you want to filter this out by the like tomorrow, yesterday, or on for the next 2 days, what are the appointed patients that can be viewed by filtering it out. Or if you want to filter it by name or registration ID, that can also be done. If you want to view only the booked ones or the checked in ones, that can be also filtered according to your preference. So now to move to the EHR, first up the doctor needs to call the patient. So or after clicking a call, you have to click on start serving. You can see over here in this token management, the patient is just being served. So once you click on start serving, you can see serving has been started. Now to move to the EHR of that patient, you can click on this action button. Once you click on this action button, you can move to this EMR and accounts. So this is where you will find the EHR of that particular patient. I will show you a filled case sheet. So this is a filled case. So this is a patient that has been visited for 3 times in this hospital. So over here you can see the vitals that has been registered for the patient, the medication that has been prescribed for the patient, the diagnosis, the clinical assessment, the visit. This patient has been visited 3 times, and the three visitation has been recorded over here. And if you want to view the previous case sheets, that can be viewed in this history. Click on the history. You can either search by the service wise or through by the visit wise. If you like the print, you can click on the print icon. And if you want to edit those case sheet, that can be edited by clicking on this pencil icon. So now I'll show you how to fill into the case sheet, to the case sheet of this patient. So for that, you can click on this edit button. So over here, to add the clinical insights, you can click on this clinical assessment pencil icon. So once you click on this pencil icon, you'll be able to add the blood group, allergies, social habits, medical history, family medical history, current medication, catheter study. All the details can be added over here. And make sure that once a blood group is added and confirmed by the respective person, it won't we cannot be edited after that. So now to take a printout of only the clinical assessment can be done by clicking on this view summary. Click on the view summary and then this can be printed out. And if you don't need some details like the blood group, not just you don't want to be printed out, you can cross it out and you can take a print by clicking on this orange button. So this is regarding the clinical assessment. Now I'll move to the case sheet. So over here, the first is what we have is vitals. So for adding the vitals, you can click on this pencil icon and then you can mention all the vitals that has been taken for the patient, and can mention the performing doctor and the staff. And if a wheelchair has been used, you can mention it and can save it. So this is how you add a vitals. And for during the during the appointment, if the receptionist or the nurse has captured the vitals will be automatically fetched over here. Next is the chief complaints. So over here you can add the chief complaints. You can add n number of chief complaints. Mention the chief complaints from this master from this below, and then mention the period. And if you want to mention any present history, the history can be mentioned, and then give the performing doctor and nurse if it is mandatory. And if you want to add any other additional notes, you can add over here and you can click on this add button. So over here you can click what chief complaint has been added. And if a chief complaint is add like you have mentioned which is not from the list, you can add it manually from here. You can click on add new chief complaint and complaint will be added in the masters. And if you want to edit those chief complaints, you can click on that specific chief complaint and you can do the editing. This is regarding the chief complaints. Next is the examination. So if a doctor is mentioning an examination that needs to be added for the patient, can be added over here. The examination are preloaded for you in the masters. Apart from this, if you want any other masters that needs to be added, we'll add it from our side, or you can add from here itself. Mention the examination, the problem since, severity of the examination, high, low, moderate, and can give a note and can save. Click on the screen button. Next is investigation. If you have any lab or radiology test that needs to be provided for the patient, that can be added from here. Just mention the lab service or the radiology service, and then if it and then you can click on this send but add button. So after adding the add button, this both will be moved to the respective module. Like for it will be moved to the lab or the radiology department. So you can see over here these the send status has been in the send state. Next is the diagnosis. So here you can mention the diagnosis of that particular patient, and if it is a high risk, you can click the check box over here, and then you can click on add. You can add n number of diagnoses or the medical history over here. And if a treatment is given for the diagnosis, you can mention the treatment given over here. Next is the prescription. So for prescription, you can click on this add prescription. Once you click on the add prescription, you'll be moved to this page where you can select the medicine that needs to be added for the patient. The generic name and the medicine category will automatically fetched. Mention the dosage, the frequency, like it is when 1:1 twice a day or a thrice a day. and then when to take, whether it's before food, after food, during bed, you can mention it over here. And then the duration. Once you mention the duration, automatically the dispense quantity will be appeared over here. Once all the details are added, the ones that are marked in red needs to be mandatorily added. Once it's added, you can click on save the medicine. So after that, will be moved to this added prescription area. Oh, sorry, simultaneously, how many medicines you want to prescribe for the for the patient, the medicines can be prescribed over here. If the doctor needs to have the view of the stock of the medicine, the stock can be viewed from the stock update. Click on the stock update and you'll be able to view all the medicines that is available in the pharmacy of your hospital. So now we have added all the medicines, and then you can cross it out. So now if you want to view this after food, bedtime, or before food in the regional language, that can be viewed by clicking on this print icon. You can go to in this print language, you can mention the language they prefer, and you'll be able to view it in the regional language. Now, for example, this four set of medicine is a common medicine for fever. So you can create this into a favorite prescription. So once a patient comes with similar symptoms and you want to prescribe the same medicines for another patient, that can be added by you just have to mention it in the like over here fever, and then automatically these four medicines will be appear over here in the prescription. For adding into the favorites, you just have to mention the prescription and click on the star icon. Once you click on the star icon, it will be added to the favorite. Now, from here itself, the doctor can send the prescription to the pharmacy. So, to send it to the pharmacy, you can click on this first icon. And if the doctor wants to just take the print of the prescription, that can be taken by clicking on this print icon. And if you want to send it on the WhatsApp, that can be sent by clicking this WhatsApp icon. I hope this prescription part is clear to you, sir. Hello, sir.
Hello.
Yes, sir. I hope you are clear with the prescription area.
Yes, yes.
Yes,
Okay.
yes, we are clear.
Next is the for for COVID and dengue can be mentioned here, and you can identify the date, like the identified date, and then you can click on add high risk. Now, from in the task order, you will be able to give the instruction. For example, this patient needs to be revisit after 2 days. So you can click on the revisit and mention, give a note over here saying that the patient needs to revisit us by after 2 days, and then you can click on add. So then the patient gets like it will be printed in the case sheet. Now from here itself, the doctor can refer the patient to admission. So for referring the patient to admission, you can go to this refer to admission. So give the reason for the admission, the hospital admission type, whether it is in-house or external hospital referral, then the mode of admission, whether it is elective, immediate, emergency, then specify that doctor whom the patient needs to be admitted under. Then the admission period, whether it is today or within 2 days, we mark the mark it into the red radio button, and then give the whether it is an insured patient or not. And after adding all the details, you can click into add refer to the admission. So this is one type of admitting a patient. And this case sheet can be configured according to the doctor's wish. So for configuring the case sheet, you can go to this settings configuration. So you can click on after clicking on the setting icon, you can uncheck the box which you are not preferring. For example, you don't want this to chart DK summary. You can uncheck those box which is not which is not mandatory or needed for your from your side, and you can save it. And if you want to rearrange this rearrange this, that can be also done. For example, the first thing that need to be added is the vitals, and the second thing that needs is the prescription. So you can click on this icon and you can change the um, positioning of the case sheet. After doing all the necessary changes, you can click on this button and then you can click save. So this is regarding the adding of case sheet. Now we also have a segregated personalized case sheet for ENT, pediatric, obstetric, diabetes, where obstetric will be able to add the GPLA details, and in pediatric you will be able to view the growth chart and etc. Next is, if you to take a print of this case sheet, that can be taken print by clicking on this print icon. Click on this print icon, you will be able to view the print of the case sheet. This case sheet header can be changed according to the hospital need. Please, sir, please do share your hospital logo and the billing address so that we can add it over here in your template.
Sure, sure.
So all the details will be added over here and you can take a print of it.
Okay.
This is regarding the case sheet. Now I'll be moving on to the treatment plan. So if a doctor is suggesting any treatment plan for the patient, this can be added by clicking on this add treatment plan. Mention the treatment plan name, the planned start date, the actual end date, and the physician name, and then this treatment status. And if a note needs to be added, the notes can be added and can click on save. This is how to add the treatment plan. These treatment plan are fetched from the backend, like from the masters, where I'll show you where to add the masters. Next is the heal IQ. So if a doctor is setting a goals for the patient, that can be set by clicking on this heal IQ. You can click on the create a goal and you can set a goal for the patient. Next is the lab and radiology, where you will be able to view the result of that particular patient under this lab and radiology. Next is the attachments, where the patient might come with previous prescription or any other hospital, like their health record. So if you want to add it into the case sheet, with the patient's case sheet, that can be added by clicking on this add new in the form of image, Word, Excel, or PowerPoint or PDF. And you can view the file according to by the period wise, like today, yesterday, this week, this month, and this year. If you have added the details yesterday, then you'll be able to view it in the under yesterday. Next is the bills. In this bills, you will be able to view all the bills that has been generated for this particular patient. And in prescription, you will be able to view all the medicines that has been prescribed for the patient according to the visit wise. So on this is the prescription that has been prescribed for the first visit, and this is on the second visit. Next is VisIQ, where in this VisIQ you will be able to view the overall visit history of the patient. You can see this patient has visited 3 times and is common with high fever and the most frequently prescribed medications, and then it will be in the form of list as well as in the form of chart. You can view that the visit breakdown as well. You can be able to view in the year of 2025, 3 times has this patient has registered the hospital. Next is vaccination, and if you want to add any past vaccine of this particular patient, that can be added by clicking on this past vaccine. You can select the vaccine name, the plan date, the vaccination date, and then you can click on add past vaccine. So now we have added all the case sheet details that is needed for the patient, and you can after adding all the necessary details and the record that needs to be recorded for the patient. From here, you can move to the doctor's dashboard. From this case sheet, the doctor can move to the doctor's dashboard and then end the call for the particular patient. So now the patient has exited the doctor's cabin. So now after that, you can click on this end. So after clicking on end, you can see the serving has been ended. Okay, that's it regarding the physician training. Now I'll show you where to add the treatment plan, the diagnosis and all in the masters. So for that, you can go to this masters in master setup. In this case sheet, this is where you will be adding the chief complaint, examination, training, class, instruction, diagnosis. All can be added from here. Just go to this chief complaints. Click on add chief complaint, mention the complaint name, and then click is active and then save. To add the training class, click on the training class and you can mention the name, the type, and the description of it, and you can save. Similarly for treatment plan. Mention the name of the treatment, the department, whether it is under which department this treatment plan is coming, and then the classification of that specific treatment, and you can save it. This is regarding the physician. Now I'll show you. This is OP regarding the OP case sheet. Now I'll be moving on to the IP case sheet. So to move to the IP case sheet, you can go under this IP in this admission list. You can move to this. You can click on this action button of the specific patient and you can go to the doctor notes. So once you move to the doctor notes, you will be able to add the notes that needs to be added for that particular patient. Select the doctor name. You can add the notes over here and then if it is just a visit, you can tick mark this just visit and then add doctor notes. Once you've added the doctor notes, you will be able to view the doctor notes underneath. So if you're adding all these details in doctor notes and the nurse notes, you will be able to create a comprehensive discharge summary. Now for an examination, go for the examination and you can mention the examination that has been prescribed for the patient and then you can save. And all the examination that has been added, you will be able to view it under this examination. Next is prescription. So for creating a prescription, you can click on this create prescription. Once you click on create prescription, you can add all the medicines that needs to be added for the particular patient. You can mention the prescribed physician and the prepared physician. If both the physicians are same, you can mention both the same name and you can save it. You can view this this after food before food in the regional language by clicking on this print icon. And now from here itself you can send. To take a print, you can click on this print icon, and after all the medicine that has been sent, you can click on this send to pharmacy. Once you click on send to pharmacy, you need to confirm this prescription by mentioning the purpose of this prescription, whether it is for new admission, daily dose, emergency requirement, surgery procedure. This purpose can be added by yourself from your end. So what purpose you like over here to be mentioned, that can be mentioned accordingly. So once the purpose is mentioned, you can mention the priority, whether it is normal or critical, and then you can send to the pharmacy. Next is the clinical assessment. So in clinical assessment, you can add all the assessment by clicking on this pencil icon. Mention the blood group, allergies, social habits, medical history, and then you'll be and then you and then to take a print, you can click on this print icon. If a lab report and radiology report has been generated for this patient, that report will be viewed under this lab report and radiology report simultaneously specifically. So this is regarding the doctor notes. Now I'll be moving on to the discharge summary. So for discharge summary, over here you can click on this discharge summary. Once you click on the discharge summary, if any attachment needs to be added related to IP, that can be added under this attachments, and then over here you'll be able to view the discharge summary. And if you want to add the details from the doctor notes and the nurse note that has been created, that can be done by clicking on this editor button. Just disable this editor button. After enabling the button, you can copy it and then paste it in the respective field. Or we also have a choice of voice to text. So if the doctor needs to say and then type it into the software, that can be also done by clicking on this mic icon. Just click on that mic icon and then you can say it, and then you can record the result that needs to be added over here. This is how you create the discharge summary. I hope this all are clear to you, sir. Hello. So that's it regarding the physician training. Do you have any other doubts? Hello, sir.
I have messaged on WhatsApp.